Hello everyone. After 2 challenging years of the COVID-19 pandemic, has this changed what you perceive as true beauty? In a recent survey we have commissioned titled What is Beautiful?, more than 11,000 women under the age of 45 in 12 markets across Asia and Europe were interviewed about how they value things around them and how they define beautiful after going through a pandemic. Taking care of your health inside out tops the list when defining beautiful, and many also feel that the most beautiful thing in life is doing good for the people around them, the communities, and the planet we live in. We're happy to collaborate with GSK to empower our customers with essential self-care knowledge and tips that help to bring balance to our mind, body, and soul. Let's hear from our pharmacists.
While sugar is sweet, it hides a bitter truth. 1 in 9 Singaporeans has diabetes. If nothing is done by 2050, around 1 million Singaporeans could be living with diabetes. Let's find out what exactly is diabetes and how do we prevent it. Diabetes is a disease in which blood sugar levels are above normal. In healthy individuals, most of the food we eat is turned into glucose or sugar for our bodies to use for energy. Our pancreas makes a hormone called insulin to get glucose into our body cells. When you have diabetes, your body either doesn't make enough insulin, which is known as type 1 diabetes, or it cannot use its own insulin as well as it should, which is known as type 2 diabetes. This then causes sugar to build up in your blood. Frequent urination, increased thirst or hunger, tiredness, blurred vision, numbness or tingling sensation in the hands or feet. Get yourself screened if you experience any of these symptoms, even if you feel well. Early detection and treatment can reduce risk of complications. You may have an increased risk of developing type 2 diabetes if you have a family history of diabetes, are overweight or have a BMI value of 23 or higher, are physically inactive, have high blood pressure or cholesterol, are aged 40 years and above, or had gestational diabetes when you were pregnant. When diabetes is not adequately managed, it can potentially result in serious health complications such as nerve damage, damage of blood vessels in the eye, kidney diseases, reduced blood circulation, stroke, or even heart attack. There are certain medications that should be used with caution in people with type 2 diabetes. Your doctor or pharmacist would advise you when necessary based on your sugar control. Generally, when you experience any pain or fever, paracetamol contained in Panadol or Poro, for example, is a much safer option for pain management as compared to other painkillers such as aspirin, ibuprofen, or naproxen. Paracetamol is safer, especially if you have any gastric, kidney, or heart issues associated with diabetes. Do discuss with your doctor or pharmacist for suitable painkiller options. What is pre-diabetes? Pre-diabetes is when your blood glucose level is higher than normal, but not high enough to be diagnosed as diabetes. If you can adopt necessary lifestyle changes during this period, you can reverse this condition. Here are some tips to prevent diabetes. Go for regular health screening, especially once you turn 40 years old. Eat a balanced diet by ensuring that you moderate your sugar, fat, and alcohol intake. Eat fresh fruits instead of fruit juices or canned food. And select foods rich in fiber such as brown rice and wholemeal or whole grain bread. Lastly, exercise regularly and maintain a healthy weight. For more information on diabetes and its management, head down to any Watson store to find out more from our friendly pharmacists.